This is CGTN, China Global Television Network.
Hello and welcome to Insights and Impact. I'm Xu Qinduo. Western media has been criticizing China's COVID-19 policy since the very beginning of the pandemic, and China's recent shift in handling the virus has triggered widespread discussion. Western media says China's policy is a failure, its economy has a dim outlook, and China lacks transparency in providing COVID data. Do these criticisms hold water? In their coverage of China, are Western media outlets providing responsible journalism? What role should the media play in the fight against the pandemic? To answer these important questions, I'm glad to be joined by Mr. Muhammad Zamir Asadi at Independent News Agency of Pakistan, Mr. Tristan Duterte Nodalo at CNN Philippines, and Mr. Sam Minia at Khmer Times, Mr. Eric Bigan at Kenya Broadcasting Corporation, and Mr. Fortune Abong at News Agency of Nigeria, and Mr. Mubarak Mugabo at the New Vision in Uganda. Welcome to the discussion. I will start with actually a brief review of the past about 3 years. China adopted a dynamic zero COVID policy, and recently it refined its policy and reopened the borders as the variant obviously is getting milder if you compare it to Delta, for example. So I will start with Mubarak. What do you make of China's say, pandemic control and prevention policy in general?
Thank you so much, Chindo. I must say that China, I think, has been one of the most effective, with the most effective policy in ensuring that COVID-19 is defeated. I was in China the whole of 2019 while attending the China Africa Press Center fellowship. And by the time COVID was declared in China and Wuhan, I was a week out of China. And fortunately, I personally went back to China in May 2020 when actually China was experiencing the worst time. But also other countries in Europe were losing hundreds and thousands of people across the European continent and in the United States of America. Africa at that time was still not so much affected, but the measures were put in place, and with support of China having different vaccines, equipment, PPEs, and all sanitizers and masks, it quite helped in preventing the mortality in Africa. I came back to China in 2020, and I spent most of my time in China, or from 2020 to around mid last year. And I can tell you, I have experienced the bigger part of COVID-0 in China, and I can tell you without fear of contradiction that it's the most effective policy that has protected lives of millions of people in China. From my personal experience, all the time I spent in China, I never contracted
Seems there's a
COVID-19.
connection. Yeah, okay.
I contracted the virus.
Well, Eric, let's...
all the time I was in Beijing, all the time I traveled to different cities.
Yeah, I will come back to you.
All the times I visited different cities.
Right, Eric.
I never contracted COVID. I contracted it when I'm back home.
Okay, let's say zero COVID, obviously. Eric, let me ask you this question. I think when China adopted this zero COVID policy, of course there are occasionally one city or one area or one region there will be restrictions because there's a small outbreak or infection, but in general the rest of the country would be free from the virus, and the Chinese population basically were living in a virus-free environment for nearly 3 years. And people outside China I'm not sure they are fully understanding or they are fully aware of that kind of a situation. In that environment, it's very different from, say, with constant infections, more or less.
Thank you. I think just like Mugabe mentioned, I do agree with him, I think, in totality, because in my view, I think China has done everything it could to first, number one, ensure that its citizens are safe, that their health has not been jeopardized by this pandemic. You mentioned COVID-0, and rightfully you mentioned that some people question whether it worked or it didn't. And actually some say the reason as to why China has reopened is because it did not work. But I hold a different view. If we've been following events for the last few years, like you said, the fact is, from the year 2021, 2022, anyone who was following the situation in China, China used to report less than 10 positive cases of COVID-19. And majority of those cases actually were cases that were imported. We cannot then turn around and say the policy that China implemented to see to it that the country is rid from this virus did not work. So in my opinion, looking at the situation in China then and what has transpired until now, it is important and very appropriate to say that the policy then worked. And it's been something more like we are dealing with a virus that today projects something different, and the next day we see it differently. And the fact that then there's been these mutations, there's been this reaction to the virus differently, I think that is what China has been trying to do its best to see to it that how do we handle this? We have a new variant. I mean, through that period of time, I think China was able to cope with around at least 10 variants of this virus. And back then we didn't hear a lot of noise concerning what was happening in China. The reason as to why we only started hearing so much about China and COVID is because when there was reopening, then there is expected there was going to be a surge. And this surge is not only happening in China, I think it has happened elsewhere in every part of the world. So to me, I think it is unfair then to come back and just pinpoint China, whereas the situation as it is now in China, I think is almost happening in the rest of the world.
Mm-hmm. Well, Zamir from Pakistan, when people talk about the zero COVID policy, some would say it's, China adopted such a policy not because it's easy, because it saved lives. It could save lives, and it saved lives, obviously. What do you make of that?
Thank you very much, first of all, for inviting me to discuss on this very important topic. And this is a very good news that whenever, at the start of this COVID-19, when we were getting some of the very bad news from all over the world, so people were only discussing China. And right now, when China has opened itself, again, the international media, the international community, they are discussing China. So it means that there is something very good about China, that whenever even it is going to, impose the lockdown, or it is going to reopen, the China is being discussed by the international community. It means China does matter in the international affairs, in the regional affairs, in the domestic affairs. So I think it's a very good news, and it's a very good omen. So I will start with the very good news that today I was just reading a Xinhua news agency, and I just got to know that China's annual foreign trade value topped 40 trillion yuan. That is around $5.94 trillion for the very first time in 2022. So it means that the country works to better coordinate the epidemic response with economic and social development amid complex and severe domestic and international situation. So what does this figure tells us? It tells us that the policies right from the starting of the COVID-19 and where we are today discussing this very important topic. It means that the strategies at the very different stages of the COVID-19 adopted by China, it worked very smoothly and effectively. Either it is about the social infrastructure of China or it is the economic infrastructure of China. And these policies that did not and these policies did not only help China, but it also helped the international community in reviving the economic vibrancy. So I think the China's optimization and adjustment of the COVID response and entry-exit policies are timely and necessary and will, I think, in my opinion, provide an impetus for the world economic recovery and growth. And we all know that nowadays we are getting some of the very bad news from different countries, especially from the European countries who are here in the Ukraine crisis, that the economies are very dim and it's not performing very smoothly. So I think China's support and assistance to the international community in responding to the challenges posed by the epidemic are appreciated. And by shifting the response focus from, stemming infection to preventing severe cases and caring for people's health, I think China aims to protect the lives and health of the people and reduce the impact of the epidemic on economic and social development to the maximum.
Mm-hmm. Samir made a good point about the change, the policy and its effects, especially on the economy, not only in saving lives but also a contribution to economic development there, with very little interference in the economic life, probably. And then, of course, we'll talk about the phenomenon also mentioned by Samir that when the pandemic appeared, for example, the outbreak was reported in Wuhan. China took immediate steps to halt the spread of the virus with a lockdown of the entire city and also the province later on, which Western media obviously criticized. And then within months, the virus was eliminated in the country. The country adopted the dynamic zero COVID policy from that point of time to control the spread and save lives. Again, Western media criticized. And now China has finally reopened. The media claims it's too soon, and China's COVID response has failed. So Tristan, from the Philippines, how do you view such a contradictory narrative? Obviously, people find it hard to understand.
Okay, hi, thank you for having me. First of all, I can only speak on what I've experienced when I went to China early last year. I've been to China in July 2022 until end of November 2022. So it's like I was able to witness the implementation of the zero COVID policy, and at the same time towards the end of the policy. So in terms of it's really important for journalists, for us to write our stories, to experience it firsthand, or to see it and witness it. There are times wherein we write stories and at the same time we're too far. We are so disconnected, so we don't really see what's happening on the ground. So that is why that experience that I went to China was really helpful on my part in terms of storytelling, because I was able to witness and see it firsthand and experience it as well, because that would give enough perspective on how we do stories, because it's different when I'm just writing about China from the Philippines, but it's different when I'm writing about China and I'm in China. So the important thing is we should look into different perspectives, and at the same time, it's really helpful when you are, well, that's the role of journalists, to really experience it firsthand and write the narrative, because it's difficult to write a story and then you're not there, and at the same time it's like secondhand information as well, because you don't have any idea. So when I wrote about the zero COVID policy for CNN Philippines, I was able to provide a perspective that I myself experienced it. I went through quarantine, I went through daily testing, and when there are events, then I need to go RT-PCR, show the codes and all of the health codes that I need to accomplish. So these are experiences, real first-hand experiences that I can share to our viewers. So I think the key word here is having enough perspective and at the same time experience it to really understand what the policy is all about.
Mm-hmm. Well, Sam Minia, what do you make of this narratives. Sometimes people find that they are contradictory to each other, and it's kind of hard, puzzling for people. Mr. Sam Minia from Khmer Times.
Yes, I hear you.
Yeah.
Thank you so much. About this China zero COVID policy. Sure, the media outlet, especially those from Western countries, have criticized the China government on their strict preventive measures to prevent the spread of coronavirus, describing them a violation of human rights. But how do people right to live? For some time, people appear to forget that deadly virus is killing the hundreds of thousands of people every day around the world, especially the elderly and the people with frail health. While the long-term effects of the virus remain largely unknown, the virus is also maintaining an unspecific spread. By enforcing the zero COVID policy, the China government is protecting life and at the same time, the future generation. People from other countries can feel free to criticize what China authorities have been doing, but it is absolutely unreasonable to do it without taking into account that different context, especially considering that China is the most populated country in the world. Also, looking back 2 years ago, when Cambodia was seeing the peak of the local COVID-19, our government was doing similar things, including issuing lockdown in Phnom Penh at the time, many blessed Cambodians for all strict measures. But it was this along with the commitment in roll out vaccine, with allowing the country to open up today. On the positive side, the zero COVID policy did a little interrupt many adventures in China. I had the most beautiful time in China, enjoying visit a lot of places in Beijing or another province in China too, like a Great Wall and Forbidden City, something that I think the China zero COVID policy is a great approach to protect lives in the world. Thank you so much.
Mm-hmm. Well, Mubarak, if you look at the criticism recently, they would say, oh, the Chinese reopening is not well prepared. It's not like well organized, etc. The thing is, like, if you look at the U.S. policy, for example, how do you say, comment on a policy by which 1 million lives were lost? Can you call it like well organized or with a full preparation?
I think it's about the American
Mubarak, please. Yeah, Mubarak, please.
Qinduo, if you can repeat the question, I had a network breakdown. I couldn't hear you well.
Oh, okay. Let me repeat the question. The question is like, if you look at the recent criticism on the Chinese reopening, the focus is like, oh, China failed to prepare very well or did it in a well-organized way. But then, here is a case in point. How do you comment on the U.S. policy by which 1 million lives were lost? Is that well-organized or is that with good preparation?
I think, as Zamil said in the first place, China as an issue, it has become an issue, not only in the region, but a global phenomenon. When COVID lockdown, the first COVID lockdown was instituted, the criticism we were reading in Western media was that this kind of lockdown and restrictions were actually violating human rights, and they were against, the essence of freedoms of expression and association and all gatherings. But at the same time, China is one of the last countries that actually is the last country to lift most of these stringent restrictions. You also see that the criticism is still coming. So it simply tells you that the criticism is not about whether the policy was effective or not. The criticism is about China. China has to look bad at all costs. They always ask that question, at what cost? But I think the Western media has that narrative of depicting China in a most negative way, whether the policy was effective or not. But also the figures and the numbers speak to themselves. The figures shows that actually China has protected many lives as opposed to other policies in other countries. US, which is actually mostly criticizing China, has lost over 1 million people, and it has never been heard of in the whole world. So I think whether, this whole opening up, many of them were tying it to the voices that were coming in from public. Then if, for example, the Chinese public would stand up and say, we are tired of this policy, and the government listened to them, how democratic this government is and listens to its people. So it's all
seems
contradicting.
Okay.
China, rather on the policy perspective, but certainly the numbers has spoken louder, and the numbers that shows that China has protected the biggest population in the whole world. That's quite commendable, because any population, any lesser population, the manner and the processes in which China has opened up, then actually you would even ask and say, maybe China should lock again, because if you're saying that it is not organized, you're simply saying that China shouldn't have opened now. It's quite contradicting from either side that you want to look.
Mm-hmm. Well, do we have a Fortune now? Mr. Fortune Abang, if you look at they say, oh, Chinese pandemic policy is a failure, or the thing is like, what's the standard? What's the yardstick? Is there any country we can call it's a success? In particular, Western countries, where the criticism are often from. Can we turn on the mic, please? It's off, seems.
Can you hear me now?
Yes, go ahead, please.
Can you hear me now?
Yes, go ahead.
Okay,
please.
thank you. Okay, I wouldn't concede to that school of thought, because being an eyewitness to what China really did to contain the pandemic is applaudable. It's indeed applaudable, because it's not enough to find faults over what people are doing without even suggesting way forward to what should be done, and without even giving the right information about what is really on ground. There's one thing about the paradigm of what the other countries are not doing, or what the other countries are doing, to what to state about what is really on ground in China. Personally, from my eye point of view, I observed that China took a very strategic step in terms of designing Class B infectious disease, and down from A, turning it down to B. Definitely that's not a laissez-faire approach. That is a success story from A to B. You don't just skill people by what you think of them, or by analytically jumping into hasty conclusions, but you need to also look at what is working. Is it a success is it a deviation from the past of what have been? And China has really recorded a remarkable success, judging by the 3 years of pandemic. And it was able to contain, it was able to set mechanisms in place to check excesses, to prevent further infection, to also make the people take ownership of being very careful about the transmission. So I think China is really taking a lead in this global order. And I think very many countries, especially the Western countries, should rather learn from China rather than criticize China.
Mm-hmm. Well, of course, the criticism also is about the so-called lack of transparency or data sharing, or the pressure or extreme pressure on the Chinese medical system. So, Eric, the issue is, if you look at the pressure, when countries, when they were dealing with basically every country, even now, they are dealing with the pandemic, or outbreak, small or large scale. Inevitably, there will be pressure on the medical system, pressure on hospitals. For example, in Beijing, if you have 70% of the 20 million people in Beijing got infected in like 1 week or 2 weeks' time, of course, there's with a sudden surge of infection, there's a need often with the medicine for cough, for headache, for whatever issues. I mean, there is pressure. There will be pressure. It's just a part of the life, probably, if you open the society. And so I think every country at a certain point experienced that kind of like a shortage of medicine, etc.
I do agree with you, and you are right. I mean, you look back at the last few years. Um, China, first we have to acknowledge the fact that it is the first country to record a positive COVID-19 case. And what happened after that? China was able to mobilize resources, come up with makeshift hospitals. I mean, was able to secure people, those who had tested positive, and just to see to it that there was no spread at a bigger magnitude than maybe would have witnessed if those measures were not put in place. When you look back 3 years down the line, culminating in China now reopening after lockdown. First, let's admit that the lockdown, 3 years is not a short time. That is a very long time. The economy, in one way or another, might not have done well. It is a sacrifice, both by the state, it is a sacrifice by the population, just not doing things normally for 3 years is not easy. Now, you're talking about pressure. Pressure in this case, I mean, China is such a vast country. The population is 1.4 billion people. It is a unique case. There is no other country that has a situation similar to China. So it is so easy to compare then and say whether China has done right or wrong in reopening. But coming back to pressure, I mean, look at the numbers. You're dealing with 1.4 billion people. How do you reach them all? And looking at the country, the terrain, there are countries, there are parts of the country that are so remote. You need so many resources to be able to reach them, to be able to address their cases. And how also do you deal with the situation whereby people may not even volunteer for testing? I mean, so it brings us back to the issue of numbers again, because as we have seen the virus since it broke out from Delta, Omicron, and the other variants now, it is manifesting differently from people. There are those who will manifest symptoms. There are those who will not manifest symptoms. So even if you test, not all people will always be like, okay, you will not really tell the numbers exactly as they are. But looking at the pressure that this COVID has had in facilities, I mean, at some point here in Kenya, in Nairobi, we could not handle it. We just had tents just trying to accommodate people. And look at professionals. How many professionals, doctors, medical practitioners do you have to be able to deal with a surge in cases? It should not be looked at differently with what is happening in China. The reality is, at the end of the day, with the numbers in China, with the numbers in Beijing, like you said, it is not possible to handle all those numbers of people at one given time, because you can't tell that today I'm going to be infected or that other person is going to be affected. So I think as far as reopening is concerned, China was well informed. At the end of the day, I think you also need people to interact so that by interacting, I think there is a way, in a way, like we've seen, the doctors, professionals can tell us, but in a way, I think it has an impact on how then the virus is able to be transmitted from one person to the other, and its effectiveness is concerned.
Mm-hmm. Asadi, if you look at the criticism, for example, lack of data or transparency issue, one Chinese expert pointed out, the priority probably should be the sharing of the information of any possible potential new variant in terms of international cooperation, in terms of a joint fight against the pandemic, against any emergence of new variant, and save lives. Probably that's a priority for the Chinese medical staff, for the Chinese hospitals, for the Chinese government, instead of counting the toll, how many were in ICUs or how many died of the disease there. So what do you make of these different priorities or concerns or criticism there?
Yeah, thank you very much once again. I think it has become a habit of criticizing China. Whether it is about the economic system of China, whether it is about the social structure of the China, whether it is about the peaceful rise of the China, whether it is about the peaceful human rights situation in China, whether it is about Hong Kong, Taiwan, or other issues. I think it has become a common fashion in the Western capitals or in some of the Western think tanks or in the Western media to criticize China. And it is not about criticizing the different issues, but I think it is about the mentality, the ideology of the people there in the Western capitals that do not want to see a prosperous China. They are working on an ideology to contain China. So I think it is the same kind of the approach, and it is I think the same kind of the narrative that is being developed about China. And I think it is not fair. What we believe that from the last 3 years, we are reading reports from China. Our friends are there in China. Our Chinese friends are there. Our Pakistani friends are there. They have been telling us very consistently, very regularly about the measures taken by the Chinese government in Beijing, about the provincial governments, about the local governments, about even in the villages. And the thing which you are talking about, the transparency, I think our friends, they have already told us that the World Health Organization and the other international health institutions, they have posed the confidence on the Chinese government data sharing system. And actually there is a problem. China successfully contained this COVID-19 pandemic, and they really saved the lives of the, I think, not millions but billions of the people in China and across and out of China. So this lower figure of the deaths in China and the patients in China, it was actually a problem for the Western capitals. Then that's why they raised the questions on the transparency. But I think that if the Western capitals were not able enough to contain the number and to provide the good health measures or the security to its citizens, then it is not the fault of China. The Chinese governance system, it activated very timely, and it worked very timely. So that's why the number of the patients and the deaths, they were in control. But I think the Western capital, they did not digest this kind of the success of the Chinese story in this pandemic era. So I think that's why we are seeing the criticism from international capitals about the transparency. I was reading a report from the Chinese foreign office from even the last day. They have urged United States to release the data about the XBB, the new variant that is spreading very rapidly in United States. But the United States government and their health institutions, they are very silent on it. They are trying to hide the data. And I think this act of United States, it will not serve the interest of the international community. I think the United States should come out very clearly and transparently. It should share the data. It should share the other symptoms and the issues that are being linked with this new XBB variant that can also become an other pandemic wave, and it may pose a new threat to the security of the life across the different countries. But in this, I would really appreciate the Chinese government, who have not only vaccinated its people timely in the first phase of the COVID-19, but it also helped more than, I think, 120 countries of the world by providing billions of vaccines, medical kits, testing kits, and
Yes.
even the Chinese government, dispatched its medical staff to the international
Right.
countries, when United States and the European very reluctant to share its medical experiences and the vaccines with the developing countries. But China took the step, and China lead the campaign. I think China needs a well, appreciation, and we are very hopeful that in the coming days, when now China is reopened, China will come up with more technical and the medical support for the international community again as well.
Well, Tristan, recently the Chinese health authorities were in talks with the manufacturer of medicines related to the pandemic control. They were successful with some cases, with some of the medicines, and then there is a failure, of course, to talk to the manufacturer of Paxlovid, the antiviral medicine, because of the price, so they didn't reach an agreement. Then there is the question about the relationship between, say, public health interests and also commercial interests of the producers. So, how do you balance, on one hand, people in need of the medicine, on the other hand, of course, understandably, the manufacturer, the investor, they want to take care of their profits there.
Okay. Well, from what I've experienced and what I've witnessed here in the Philippines, there are also issues regarding who would procure the vaccines, who would be prioritized when it comes to the medicines, who will share the technology, because this is from private company or private institutions, and yet we want to save more people. What government officials here in the Philippines did is that they kept on talking, find the middle ground, find where these companies can still pursue its goal or intentions, and at the same time, the government would also lay down what their plans also. So I think during that time, especially during the pandemic, we've seen it firsthand on how private institutions and government institutions work together so that they can serve people better. Because at the same time, these private companies would also need people to buy their products as well. So if they will limit it to what they want, and they would not talk and bring forth different proposals on how they can collaborate further, then it'll be disastrous, not only for the business but also for the entire system. So what I think other countries should also look into is how private and public partnerships can foster, especially during in times of emergency or health emergencies like this pandemic.
Well, San Minier, of course, I mentioned earlier, they failed to reach an agreement because of the price, the high price. And then there is another question about these developing countries, some of the medicines from the developed world, in what way they can provide better assistance to developing countries in their fight against the pandemic. Saying that because, China, of course, if you look at the overall economy, people often say, oh, the second largest economy is almost like a developed world. But if you are in China, you understand 1.4 billion people, as mentioned several times by our guests there. It's unbalanced society, regional differences, and also a lot of regions, in particular in per capita GDP, still a developing country that's focused on further development. So what do you make of this assistance? In what way can we better, let the assistance from the developed world to the developing countries?
Thank you so much. Among the world is concerned of facing the COVID-19 crisis, economic crisis also. The inflation rate is also under not control to hit by COVID-19 outbreaks. Over the million of people got infected. But China government keep a good in progress. The economic is very good in progress than other country, like another Western country. During the world is facing with COVID-19, the economic crisis is under not control, but China is control of the economy rates during the past 2 years. China's strict measure makes sense to COVID-19 control in China comparing to other. Under this approach, China government fully control of the COVID-19 outbreak from one province to another province. I think the China zero COVID policy is provide the benefit to economies increasing in China. And when the China is locked and another country cannot fly to China, but it is called the best measure approach to for economics increase, while another country is inflation rating under not control. Thank you.
Well, of course, we are talking about the media. Then there is an issue of the role of media and the impact of their coverage. The responsibilities, for example, in their coverage of the pandemic and other issue. So, Eric, I have this question for you. How do you comment, or what do you make of the media coverage of the pandemic, not only about the Chinese situation, also globally probably over the past 3 years in the fight against the pandemic?
I think if there is one criticism media is going to take, in as far as media coverage of COVID-19 is concerned, is the issue of consistency. When we started, I think, yes, there was no much information, but at least we were able to follow what the experts were saying from the beginning, because this was a pandemic, that this was a disease, this was a virus that no one knew so much about. So we had little information about it, and so we depended on the experts in the field. And so I believe we should have done better by being consistent with that, just remaining with what the experts are saying.
Seems there's a connection issue with the internet. Let's turn to Fortune. Mr. Fortune Aban. There's upside down.
Aban,
yeah, can you adjust your camera a little bit, please?
Okay, is it okay like this?
Horizontal.
Is it okay?
Yeah.
Is it okay?
Yeah. Mubarak, let's turn to Mubarak. Mubarak,
yes, Chip.
Of course, there's, in the West, people tend to stress very much about the press freedom. But then in China, I think in our own discussion, many times, we stress responsibility. I mean, for media outlets, there's a responsibility to disseminate information in an objective way, truthful information, because that helps the government, helps the individuals, helps the groups, organizations to fight the pandemic effectively. But if there are, let's say, like fake news or misinformation, in particular at the point of like conspiracy theories, social media, if you look at the situation in the US, that's in a particular case, that has done basically, create a lot of worry about the role of media.
And well, it's very important that when the pandemic broke out in China, one of the issues that were raised by different authorities and different organizations, including the World Health Organization, was the most important role of the media in combating and also fighting the pandemic. However, the pandemic surfaced at a time when the media was also still entangled in a smear campaign countries against the citizens and the Chinese people. And certainly that did not only stop from that, it was an escalation of trying to amplify what was already in place. And
have we lost? Yeah, we lost Mubarak there.
Calling the COVID-19.
Yeah, can we start Tristan, please? Yeah.
Hi. Okay. The role of media in reporting during the COVID-19 pandemic, I think like what my other colleagues are trying to point out is that we have a very crucial role to play, because whatever information we share to the public could save or endanger their lives, right? That is why during the start of the COVID-19 pandemic, we have a very tough battle, because apart from delivering the information, we are also fighting misinformation at the same time. That's why our experts here say that it's not only the pandemic, but also an infodemic, because there are so many information that you have to check and verify before you can actually report. Now, the crucial role of the media here is that we need to deliver news that are accurate, fair, and balanced. We really need to let experts talk and get their information without us adding our comments or whatever our personal biases or whatever our personal opinions are, because the role is to just deliver the truth, and at the same time let people decide on their own whether they will follow this or that, because we don't need to impose information. Our obligation is always to the truth, and the truth is and that's our main role, just to deliver the truth and to the people, because that's the role of journalists as well, especially during the pandemic. And And there are so many negative stories. There are so many sad stories during the pandemic. But like what our guiding principle is, we need to report these stories no matter how grim these are, especially during the pandemic. So it's really also a test of strength and credibility of media in general during the pandemic.
Mm-hmm. Well, Tristan, you mentioned a good word here, credibility. And then if you look at the numbers, for example, there's an opinion poll conducted by Gallup in October 2022. The results showed that 28% of the U.S. adults say they don't have very much confidence, and 38% said they have none at all in terms of confidence in newspapers, TV, and radio. I wonder if is it because of the lack of trust in the traditional media? So people turn to social media where you find the 4chan, for example. You find all kinds of conspiracy theories like 5G towers that spreads serious issues, viruses even, or vaccine skeptics. People don't trust the vaccine, or they don't put on a mask, for example. So the lack of trust. How big an issue is that in terms of, towards the traditional media?
Okay, lack of trust, meaning I think what we are seeing now is a change in landscape. This is not where like the TV is still king and dominating every form of mass media. What we are seeing now is there's this social media that's providing an alternative source of information wherein people would go to social media that would fit their narrative and find information that they would think would agree with their own without actually checking whether it is coming from the right sources or reliable sources. So given this survey, I would also like to say that, for example, in the Philippines during the pandemic, 67% of Filipinos still trust TV. 68% go to social media. So given these numbers and also the one you've mentioned, I think these are indicators that us working in the media should intensify further our quest for delivering news and never be like discouraged with these numbers or whether there's lack of trust. I think we should prove to the public or to the people that we are trustworthy. So we should use this data or studies so that we can improve our work and the kind of journalism that we do.
Mm-hmm. Well, Eric, speak of this again. Continuing this topic, this theme here, the credibility of media, whether it's a traditional media or social media, that's critical because if you once lose the trust of the audience or readership, and then it is very difficult to regain their confidence, their trust. Recently, there is a piece carried by Washington Post, which said Russian trolls on Twitter had a little influence on 2016 U.S. voters. We know that over the past, almost 6 years, people in the U.S. basically got divided because of, Democrats trust or believe there is Russian influence in terms of the election results, and then Republicans think otherwise. There is a comment interesting. They say the establishment spent years tearing the country apart over complete, this is a strong word, I would say, this is nonsense here. So what do you make of that, that kind of very important mainstream media basically reporting fake news and for political purpose, because of the party affiliation possibly?
Sorry, I got disconnected early. I think is the issue of a network. I'm far away in the province. But on the issue of, social media, the issue of traditional media and where we are as far as how the public view us today, I think we brought this to ourselves. I think the issue of us trying to have the numbers, the issue of trying to have the following, the issue of then trying to be popular as opposed to being objective and accurate is what has got us here. I'm happy because Mubarak is here. The year 2021, I think Mubarak, there was this story about death trap by China in Uganda. And people were talking about Entebbe International Airport being confiscated by Chinese authorities because, yes, Chinese financed the reconstruction of the airport. Interestingly, I received a call from a journalist from the mainstream media asking me to carry the story and why I had not carried the story, and yet the Chinese are confiscating an airport in Uganda. It tells you how far we have gone just to try and paint China in bad picture, or you want to paint a country that you differ in terms of policy in bad light. And the sad thing is that we as media are, have found ourselves being engrossed in all these. The only way out of this, if you ask me, is let's remain objective. I mean, if we are reporting about China, if we're reporting about the US, can we do it without, perceptions, without bias? Can we do it without being suspicious of whatever any country is doing? That is the way, as media, we need to do. If China tells you today we have reported this number of positive cases or deaths as far as COVID is concerned, why should you be suspicious of the fact that those numbers will not paint a true picture of the situation there? If today you want to report a death, who does that? As a journalist, in the first place, we don't have the authority to declare someone dead. It is a doctor who does that. Looking at the WHO today, what is it depending on? It is depending on numbers provided by governments all over the world. So there is no way then today we will accept numbers given to us by US authorities or Japanese authorities or German authorities or British authorities or Kenyan authorities on that matter. And then when the same numbers are given to us by Chinese authorities, then we are like, I think there is something that China is not telling us. Let us look at everything as it is. Let us report things objectively, and we are not competing with the social media. We are not competing with the new media. They have their space. But people at the end of the day will come back to us to confirm and verify that the information that is circulating in social media is true or not. And that leaves a heavy responsibility on our part as journalists to make sure that the information that we are putting out there is real. I'm happy that recently, when we spoke about when the issue of reopening of China came into force, and the subsequent travel caps that were imposed by certain countries, I'm happy that BBC went ahead and did a reality check on whether by trying to stop Chinese travelers from visiting certain countries, then that was going to stop the virus. In the reality check column, I saw they spoke to numerous experts as far as this virus is concerned. And they are all in agreement that indeed this is not going to help much as far as the spread of the virus is concerned, given that it is a virus that is contagious and it could actually spring anywhere. So to me, I think as journalists, we have a sole responsibility to audiences to report the truth, and on matters that we are not so much well-versed in, then let's take it back to the experts. Let the expert tell us exactly what it is, and that is what we should give to the public, as opposed to being like guys who are chasing numbers, social media influencers, just for the sake of numbers and popularity.
Interesting point. If you turn to the experts or if you turn to politicians, there will, a difference will be made probably over there. Let's turn to Asadi, Mr. Asadi. If you look at this coverage, reporting on the Chinese, pandemic situation, we know that in particular between it's in a way impacted or infected by. Because influenced by the relationship, we know the geopolitical relationship, for example, from 2018, the U.S. And Donald Trump basically imposed a trade war on China, or tech war, or media war, whatever you call it, on China. And Trump and his people labeled the virus as the China virus. And then now we have the Biden administration basically imposing restrictions on the Chinese travelers. This raised concerns, such a policy may again lead to anti-Asian attacks and discrimination issues. And of course, the U.S. is trying to contain the rise of China. Politicians in the U.S. Call that this is a new Cold War. We must win this Cold War against China. That more or less influenced their media coverage in terms of China. What do you make of that? How can the media be independent? Be objective in their coverage? Either it's pandemic or whatever topics.
I think most of the people who are present here discussing this very important topic, we are aware that in last year, the American administration, they have passed, the Congress, they have passed out a very huge amount of bill that will, lead a campaign to tarnish the image of China across the globe in various countries. So I think it is all about the mentality of the politicians and the Western media think tanks to tarnish and to disrepute the development and the prosperity of the China that is going on. I think the global resurgence of the COVID-19 has prompted media outlets in some Western countries, including the United States, to launch yet another campaign to tarnish China. So a quick flashback of the ravages of the pandemic will show how some US politicians and media outlets allegations that the virus had spread across the world and across the world at an amazing speed due to China's lack of transparency during the first wave of infection. So I think it's very unfair. They also criticize Beijing for being too strict with its lockdown regulations. And now those people are, criticizing China for easing the strict anti-pandemic measures, saying it could spread the virus, at a much faster speed. So I think the fact is that the Chinese authorities, ease the restrictions after leading epidemiologists analyze that the move will not, endanger most people's life. This shows some Western politicians' primarily objective is to undermine Beijing's domestic and international efforts to combat the pandemic. So I think the media has a very vital role to inform the public. It's important for media outlets to report on COVID-19 policies accurately, regardless of where they get implemented. Misrepresenting the fact, can also lead to misperception. So Western media reports that focus on a single aspect of China's response, such as of its use of lockdowns, often fail to take into account its overall approach of control the spread of the virus, and reports that presents a one-sided view of China's, you can say, the overall policy shift.
Yes, seems we lost Asadi over there. Well, on that note, we concluded today's show. Many thanks to our guests. You can also find us on the CGTN app on YouTube. I'm Xu Qinduo. Thanks for being with us. See you next time.